Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today we have part 2 on our series of how to determine what your neutral spine position is for your lower back exercises. We're going to focus on body sway and pain movement tendencies today to help you design your unique healing exercise program for lower back pain. So in part 1 on this topic, we described going through different ranges of motion with the lower back to determine end ranges of tolerance levels, where in extreme motion you're going to have pain, let's say leaning to one side or pelvic tilting, and then going the opposite way and feeling a pull or a stretch or discomfort and placing the body in that particular range or plane of motion at the midpoint between those extremes. And that's a basic exercise or tenet that we use for determining neutral spine positioning. However, not all motions are painful, and some of them apply to certain people and others do not. But one of the basic things that we want to keep in mind when determining neutral spine position is what is our tendency to sway when we stand on, let's say, one leg, or if we have the eyes closed, or if we're in an unstable position, such as standing on a wobble board or wobble disc like we use for rehab. We all have a tendency to sway to one side. We may tilt to one side. We may twist to one side when we're unstable. You can check this on yourself by standing on one leg and just seeing what happens with the eyes open and with the eyes closed. Now, if you do, let's say, a lateral flexion maneuver like I did, the first maneuver when you sway, not your recovery from that, but the very initial maneuver when you close your eyes and look for balance. If you have a tendency to tilt that way, see if that direction of motion is also one that typically irritates your lower back pain. Regardless of whether you have a degenerative disc, herniated disc, stenosis, spondylolisthesis, facet syndrome, chronic strain, typically you're going to have a sway pattern that many times goes into a direction of pain. That direction you have to watch out for when designing your healing exercise program, and you want to actually choose exercises that strengthen your ability to avoid that by challenging that side. So for instance, let's take this particular unique motion of left lateral flexion with my rib cage. If I stand on one leg or another leg and I see I'm stable there, but my first motion is tilting to that side, and it could be that my first motion was extension, or my first motion was flexion, or my first motion was rotation with either my pelvis or torso, whatever it was. See if going in that way with your eyes open and stable also irritates your back pain. If it does, typically that's a good result that correlates your body tendencies of postures and instabilities with the direction of pain. That's a direction then that you want to plug into your healing exercise program to avoid. So for instance, if I had a lateral flexion problem, I'm going to be choosing exercises that help me avoid lateral flexion. What would they be? Well, side planks, for instance, are great exercises that help me avoid lateral flexing. I want to choose the side that makes me laterally flex. Now in this position, my body wants to drop, my torso wants to drop, and that would laterally flex my right side. So if I had a right side tilting problem, this would be a great exercise to train to resist that challenge. If, for instance, I'm doing cliffhangers and I have a tendency to laterally flex to the left, I'll want to design a program that emphasizes right lateral flexion. So for instance, I'll want to choose a cliffhanger exercise where I'm emphasizing more repetitions and resistance going to the right, which builds my resistance up so I don't lean to the left as much. So we always want to think in terms of planes of motion, both sagittal planes where we're going front to back, anterior and posterior pelvic tilting, lateral planes of motion in the frontal plane, and in the transverse plane, rotation, we want to use exercises that do that. Things like rotational planks, things like TL band and hip rotations that we've demonstrated in other videos. You're going to be rotating into the direction opposite that which you usually sway. So you're strengthening your ability to maintain a position or a postural stability motion away from what you usually do. In that way, in your daily activities, you're strengthening the opposite or antagonistic muscles to your usual sway and pain to help you not only while you're working out, but in daily and sports activities to avoid those pains that are caused by typical postural sways and positional tendencies. If you like this video on neutral spine positioning and lower back healing exercises, feel free to subscribe to our channel. We got a lot of great videos out there. If you need a specific healing exercise program for your lower back pain, visit the painfreeandfit.com website. We got a lot of great personalized programs to help you determine your body mechanics, your postural issues, body sway issues, stability, muscular issues, all packaged in a workout program that you can tailor for your unique problems. If you have any questions about obtaining your neutral spine position, your neutral spine muscular tendencies, feel free to write in, contact me. We have a great new video conferencing ability where we'll be able to get together one-on-one and go over your posture, your issues, and design not only a exercise healing program for you, but also help you with your body analysis to know which direction you need to go. I hope this Part 2 series on neutral spine positioning helps you formulate your healing exercise program for your lower back chronic pain.